Hello, everyone. Thank you for signing into this webinar. I see that some people are still joining. I just want to make sure that the sound quality is okay. So if I could just get an indication from Pablo that the sound is good.
Yeah, it's good one.
Yeah, it's good. Okay, great, good. So we will get started on time and recognizing that some people are still joining. My name is Gwendolyn Blue, and I will be delivering this presentation along with my colleague Melanie Rock. I am an associate professor in the Department of Geography at the University of Calgary, and Melanie is an associate professor in the Department of Community Health Sciences. And we welcome this opportunity to present an overview of a recently published commentary, and more importantly, to hear your thoughts and perspectives. I will say that delivering a webinar to an audience that I can't see your faces and is quite a challenge, but I'm really looking forward to our conversation, although a much mediated conversation as we move forward. I would like to say just from the outset that we do not have any competing interests to declare. So our aim in this short presentation is to highlight how insights from more than human geography and critical public health can help to address the social complexity of viral pandemics such as COVID-19. And our goal really is to point out areas that will warrant further attention. We both believe that such insights are necessary so that certain dimensions of public health, and particularly the social determinants of health, are not overlooked in our collective response to this devastating disease. As theoretical social scientists, both Melanie and I bring insights that may not be familiar to those who are trained in the natural sciences or in the behavioral social sciences. And so what we are going to be doing as we walk through this commentary is to be careful to explain our terms and the implications that we see that our commentary is addressing. So anytime that you have questions about our terminology, because we are drawing on different fields in this presentation, please do let us know if anything isn't clear, and again, particularly for the implications of this commentary. So to begin, I want to clarify just a couple of terms that we are using. And first, we'll start off with the term more than human geography. And I've added and public health because there are more than human streams in public health as well. More than human refers to a broad stream or field of research in the social sciences that basically challenges divides between nature, society, and technology. And particularly, it challenges the humanism in the social sciences and in public health. So the key insight that we're bringing from this field is that what we call the social, which we often think of refers just to humans, and in the social sciences that has been a very long tradition of equating the social with the human, is made up of more than human entities and relations. And so I've brought just a couple of examples. The first one, if you can see on the left, is a picture of a dog wearing a mask. And I will say that I'm a bit dog-centric in my example because I have a dog, but we do have relations with animals and many relations in our lives that are very much part of our social relationships. And these have implications for the ways in which we address disease. We have relationships with animals for food. We have relationships with wild animals, and we've seen this in the ways in which our narratives about the disease have come about with causal origins, such as bats or other animals that may have been located in wet markets. We have relationships with viruses, and I've brought just a small representation of the coronavirus that many of us may be familiar with. And we also have relationships with the technologies that help us make sense of the natural world. And so we might think about all of this complexity as not just relations with nature or relations with technology, but relations that are inherently natural, social, and technological at the same time. And addressing this complexity is very difficult and challenging and requires certain theoretical insights. And so what we want to start out with is a couple of recognition that disease and a response to disease affects not only humans, but also non-humans. And second, a recognition that health and disease are made at the interface of nature, society, and technology. And so it's with this understanding that we root our commentary. And this was a commentary that came in the journal Dialogues in Human Geography, and there were many other articles that were presented as part of this broader dialogue. And it was an attempt to bring social science responses to COVID-19. And particularly to highlight the insights that critical geographers and those in cognate disciplines can bring in the midst of a pandemic. So our argument is that the concept of trans-biopolitics is useful to inform discussions about the social determinants of health in a post-genomics era. Or in other words, I'll just simplify that to why we need theoretical perspectives in the midst of a pandemic. So our goal over the course of this presentation is to define this term, and again, it's a term that perhaps many are not familiar with, why we think it's important as a lens into this pandemic. We have three takeaway messages, which have been described as objectives in the overview of this webinar. And I'm just going to relate these to the concept of trans-biopolitics. So the one takeaway message is that genomic and data sciences might obscure the social determinants of health. That's what I'll call the biopolitics. The second is that social scientists can illuminate the social determinants of health. And this is where I want to discuss critical engagement. And the third is that social determinants of health involve human and non-human dimensions, which I've discussed just previously. That's what we mean by trans. Before I get started into a little bit more of a deep dive into trans-biopolitics, I want to clarify what we mean by the term critical. And in particular, critical can often be thought of as dismissive, and that's not the spirit that we're thinking of this term. I'll direct your attention, just on the bottom of the screen, you'll see a screenshot of an article that was published in Critical Public Health. Melanie Rock was part of a broader collective that brought some ideas of what it means to engage with public health through the critical social sciences. So what we mean by critical refers to raising questions about power, equality, and governance, such as who has the power to shape public discussions and who doesn't, who benefits and who loses as a result of public health interventions, whose knowledge is privileged and whose is overlooked, whose lives count and whose don't, and more importantly, who makes these decisions. So both Dr. Rock and I have had a lot of experience working in transdisciplinary settings. And again, by transdisciplinary, I mean those that involve the sciences and the social sciences and combine a range of different ways of knowing. And indeed, both of our training is in essence transdisciplinary. Melanie has training in social anthropology, social work, and public health, and I am trained in microbiology and cultural studies, and we work in transdisciplinary settings. And in these settings, we and others have noticed that social science contributions, and particularly critical social science contributions, are often positioned in two ways. Either as what we'll call a handmaiden to science, in the sense that we're expected to play a communications role to bring messages of science to skeptical publics. Or else we're viewed as a potential impediment to science, as outside critics who perhaps have brought different types of engagement, but that somehow we are standing in the way of scientific progress. And this, I think, can cause a challenge when we use terms like critical, because we want to foster a different type of engagement than either of those two alternatives. The avenue that we're proposing is one to work with public health, with science, to open up understanding, to address pressing problems through something called agonism, which means that we are still holding our ground, we still are asking critical questions about power, but we are doing so in a way that engages in conversation. So the focus of critique here is with engagement. And that's why we are very interested in your feedback at the end of this, this presentation on our commentary, because these dialogues, we both believe, are crucial at this time, because many of the problems that we're facing are inherently transdisciplinary problems that require a recognition of these tensions, but also possibilities. Trans-biopolitics as a term has quite a long history. We draw on a long history to bring this term together. And I just want to provide a bit of an overview into what that history is. Let's start with the biopolitics, the root of that word. We draw that word from the work of the French philosopher Michel Foucault, and as a way of capturing how power works in modern secular societies. And Foucault's argument is that power takes life as its object. And he argued convincingly that state power works to ensure, sustain, and multiply life. And he does so through very sophisticated systems of ordering and classifying life. So state power, which involves not just the power to take life, but under liberalism has the power to make life and also let certain lives die, does so through concepts such as population, species, and publics. And these concepts are tied to modern ways of categorizing, controlling, and intervening into life. The concept of biopolitics is relatively well known in the critical social sciences, and both of us have spent a lot of time reading through and discussing these ideas. And apologies to anyone in the natural sciences or other social sciences who aren't aware of this term, but hopefully I've clarified in some ways what it means. But we felt, as we had worked through the ideas of Foucault, that it really didn't help us in making sense of contemporary circumstances marked by complexity in science, technology, and globalization, but also complexity in interspecies relations, and the ways in which these kinds of forces and complexities act upon us in our everyday life. And so in our discussions and our collaborations, we realized that a new term was needed to assist biopolitics to draw on the insights, but also to make it a little bit more relevant to our contemporary circumstances. And to do so, we brought the work of Donna Haraway and the anthropologist Sarah Franklin, as well as the work of Celia Roberts, to bear on our understanding of trans-biopolitics. And what we took from Haraway, Franklin, and Roberts was this idea of trans, to indicate the ways in which life has been fundamentally remade by science and technology in the 21st century. Let me just give you a small example to start out, and then I'm going to give you some more specific examples of how this pertains to genomics. So new forms of life, let's think of transgenic mice, are created by science and technology, but these lives come into being in the world and they also need to be governed. So to sum up, life is increasingly infused by science and technologies in ways that disrupt our previous categories and boundaries and ways of thinking. And that's what we're trying to get a handle on in a lens through trans-biopolitics. So we developed this concept in a paper that we wrote in 2000, and it was published in 2011, but the preprint came in 2010, just to give you a sense. And we wrote it in the context of a different disease, actually, bovine spongiform encephalopathy. And this was a disease that I had looked at in my dissertation. And Melanie was also part of a collaboration working on prion diseases. And so we were, again, trying to account for the complexity of bovine spongiform encephalopathy, and in ways that can help sharpen our our own social science concepts when we're dealing with these questions of power. Just to give you a sense of what that image is in the background of this, that is an image of a prion. And a prion is a really neat and unusual infectious agent in that it's an infectious protein that lied at the core of bovine spongiform encephalopathy. And what the idea for those of us who are used to thinking about infectious disease in terms of either bacteria or viruses, the idea that a protein can be infectious pretty much turns modern microbiology on its head. And many have said that prion diseases have led to a revolution in the ways in which we think about modern microbiology. But we also found that with bovine spongiform encephalopathy, or just to stop me from stumbling on that very long term, I'll call it mad cow disease as it's more commonly known. That wasn't a disease that only affected livestock, but as we're aware from that particular controversy, also affected humans and could cross the species barrier through the food supply. And so a normally innocuous hamburger all of a sudden became a site of a potentially fatal disease. The upshot being that you wouldn't know that you got the disease until years or decades later. So there was a long onset. It was a very complex disease, and we had very complex systems, and it caused a lot of very deep social changes, including changes to science and technology and the ways in which we think about it, particularly in the UK. So as a way of, again, trying to get a handle on this, we advanced this concept of trans-biopolitics as a way of thinking about the classification and evolution of life as it unfolds in complex, technologically mediated networks with global reach. So one of the things that we found was that in the context of BSE, the health of certain bodies were really taken into account by the state. And this was in the UK, but also in Canada and the United States. So the bodies of livestock, the bodies of humans, and the bodies of dogs. But interestingly, the bodies of cats weren't really getting as much attention. And so we were curious about that, since it was an indicator, one of the early indicators that BSE was a zoonotic disease. It was an infection that came in a house cat named Max. And so we were clued in to the understanding that biopolitics is this classification and evolution of life affects bodies in different ways. And so there's issues of equality and power that come to bear when we're looking at the onset of infectious diseases. So here were some of the conclusions from that particular paper that we wrote and that was published in 2011. The prefix trans serves as a reminder of the complexity of interspecies relations, particularly with respect to unprecedented changes emerging from the interplay of technological global systems that have fundamentally altered mundane activities. New pandemics in animal as well as in human populations continue to emerge as a result of these significant transformations. And we concluded by saying trans-biopolitics remains indeterminate. That is, it's very difficult to predict, because new entities and situations continue to emerge, and even seemingly isolated or incidental developments may have far-reaching effects. Now, there's no way at the time that we could have predicted what would have come to bear in 2019, the end of 2019, with the onset of the COVID-19 pandemic. And again, we weren't talking about coronaviruses, we were talking about prions. But what we found in following this disease is that trans-biopolitics had a lot of similarities, and we felt a lot of relevance for making sense of the COVID-19 pandemic. Again, here is a disease that is crossing boundaries, disrupting borders, and showing us that a virus has agency to radically disrupt and transform our social, political, and economic, environmental relations. Trans-biopolitics, I remind you, points to the complexity of our interconnections, a complexity that warrants theoretical engagement. But with COVID-19, we see something different, an intensification of scale, complexity, and speed. And I want to talk just briefly about some of those. Scale, we'll start there. So a pandemic is just in the event that this term isn't widely shared by everyone on this call, that an a pandemic is an epidemic that occurs over a very wide area. This is a definition from the Dictionary of Epidemiology. It crosses international borders. So right here, we're into this realm of trans. We also see, and again, we've highlighted this here from epidemiology, that the focus often becomes on people, but here we want to draw in that people are inherently and always in engagement with other species. We are never only human. We are always in some way in a multi-species environment. And that characteristics of an infectious agent can include the capacity to infect humans, to cause disease to humans, to spread easily from human to human. But as we know, we need to include animals in there as well. So we're dealing with a global entity with COVID-19 in a way that BSE was global, but not to the extent that COVID-19 is global. So many countries have responded to this pandemic by investing in genomics, and this is relatively new. And I want to talk about that newness in terms of the level of sophistication and the level of speed. Just a couple of examples. The Canadian government has allocated 40 million Canadian dollars through Genome Canada for the Canadian Genomics COVID network. The UK has allocated 20 million pounds to launch the COVID-19 Genomics UK consortium, and already it has sequenced 30,000 viral genomes. This is absolutely stunning, the amount of information that we're generating from this public investment. Here, just for your purposes, I've given you a snapshot of newspaper headlines. And again, unscientific, but just something that I've pulled out just to highlight the important role that genomics is also playing in our public discussions about this. So genomics is playing a role in tracking pathogens, in determining the source of infection, in fostering better understanding of viral diseases, in improving testing, and in facilitating the development of vaccines. And so here, I'm just attentive to some of the narratives that we're using, how disease sleuths are using genomics to track the coronavirus, and the coronavirus genome is like a shipping label that has let epidemiologists track where it's been. We also see references to decoding, so that the idea that the DNA is a code that can be broken and then cracked through better scientific understanding. And again, we see this in a local context. I just wanted to bring this to our own particular environment, in terms of we have quite a bit of excellent research happening in Alberta with researchers who are tracking strains of viruses and monitoring the spread. So genomics has taken a very central role in the ways in which we are responding to this. Again, I'm very aware that we may not all be sharing the same kind of terminology, and I just want to be very clear with our terms. So for those who are not familiar with genomics, what we mean by that is the study of genes and their functions and related techniques. But I would also say that this brings in an understanding of phenotypes as well as environment. So genomics is trying to take genetics, which was a focus on particular genes, and bring it into much more complexity. So here again, we start to see that notion of an inherent adding on of complexity. So we're thinking of all genes, their interrelationships, and interrelationships with phenotypes and environments, in order to identify a combined influence on the growth and development of an organism. We're here using the World Health Organization as our prime source of definitions. So just to illustrate the significance, this is the first time that genome sequencing has been used on such a large scale and with such speed. So consider, for instance, that when the first coronavirus pandemic emerged in 2002 with SARS, scientists took years to sequence, publish, and then replicate the viral genome. With COVID-19, by contrast, scientists have published the nucleotide sequence of the coronavirus within weeks of reports that signaled an unusual respiratory disease in Wuhan, China, and again in months had already replicated this to a DNA that could be used for vaccines. So I'm going to turn here to an image, and it's very, viruses are very interesting little critters because we can't see them with the naked eye, and they are submicroscopic, which means that it's very difficult to see them even with available microscopic technologies. And so we need other types of technologies to be able to make this causal agent visible. And so these are just some examples that I've pulled off the web to help us to see what the causal agent, the virus, which is now called SARS-CoV-2. This is a single-strand RNA virus with a protein coat. And just according to the World Health Organization, viral diseases represent a serious issue to public health. In the last 20 years, several viral pandemics, I mentioned the SARS pandemic in 2002 to 2003, but we also had H1N influenza in 2009, Middle Eastern Respiratory Syndrome coronavirus, or MERS, in 2012. And so viral diseases are emergent. They're something that we need to be paying attention to, and they are very, very significant and dangerous. And genomics is the lens that we're using to be able to make sense of viruses. Now, genomes are very diverse. And one thing that's interesting about viral genomes is that they are quite small. So that enables us to be able to see them in a different way. So here, and what I mean by that is what you see at the watermark of this is the viral sequence. So right here, we can see the SARS-CoV and all of its glorious base pairs. There are 30,000 approximate, little under base pairs in the SARS-CoV-2 genome, and this just shows you 350. I downloaded for this presentation, I downloaded a program called SnapGene, which allowed me to give an image of what the entire 30,000 base pairs looks like. So here we can have, again, another image of this. Now, I'm not sure those on the call how well versed you are in molecular biology, but you might notice that this particular sequence right here is not a sequence of RNA. It's actually a sequence of DNA. And as I mentioned at the outset, coronavirus is an RNA virus, not a DNA virus. So what we're looking at here is a translation. Here we have another element of complexity. And when we're thinking about trans, is that the RNA from the virus is translated into DNA, and that's just a way of standardizing that code and also enabling the production of vaccines. Those who aren't familiar with DNA and RNA, just a little schematic here that we can see that DNA is this double-stranded kind of code of life, if you will, if you use that metaphor, versus RNA, which then transmits those code into making of protein. And the difference is that whereas RNA contains the nucleotide uracil, DNA contains thymine. So you'll see T's here and not U's. And so here we've had a translation from RNA to DNA in this code. Now I say that not to be nitpicky, but to say that we are in this level of translation. And with each translation, we are bringing the virus, which itself is part of nature, into a genome, which itself is part of a nature technology culture. Another thing that epidemiologists will do is to create phylogenetic trees and other tools to track the spread of pathogens like the coronavirus. And again, I'm oversimplifying here just for communications purposes, but genome sequences are collected, and then they are sequenced. So right here, we can just see different genome sequences. And what is really interesting is that viruses mutate. So we can see mutations that are common to these sequences. And again, we can start to track any differences. So here would be the start, perhaps an older virus, in which we can start to track these mutations right here. And what we can do then is to make these into geographical types of representation. So here we can show the spread of these viral infections across different kinds of countries. And these representations, again, are wonderful for helping us to visualize something that is very complex. Just to give you a sense, and I'm covering a lot of complexity here, I've pulled this image source from this one right here of the geographical spread from this paper, P. Forrester et al., that was published in PNet, in the Proceedings of the National Academy of Sciences. Now, one of the problems, and why I want to again talk about this issue of translation, is that all too often we can assume that the representation is the reality, and that's an assumption that we need to be very careful of. The map is not the territory. The representation is not the reality. There are translations, and so we do have to recognize that these are positions that are being put forward, and some of them are conflicted. So in this particular case, this particular article and image has generated a lot of controversy and a lot of pushback, and people are concerned about sampling bias and some of the problems that might be underpinning some of this phylogenetic network tracing. I bring this example not to weigh in on this. I'm not qualified to say whether this is right or wrong, but simply to say that we have to be cognizant that just because a paper is published and just because a map is produced doesn't mean that it isn't without controversy and debate. And as many of you on this call are probably aware, but that's not necessarily something that those in other areas may be aware of. Trans, again, also refers to these translations across bodies. So again, a very simplified representation of the transmission cycle of SARS-CoV-2. And again, the source is still indeterminate, but quite a bit of evidence points to bats as the source, going through an intermediate host and then coming into humans through the droplet spread. But again, here again, we see that there's a lot of room for transmission, translation, and complexity that warrants attention. And so I give you that backdrop to come to our objectives and our conclusions. And the first one is that the social determinants of health involve human and non-human dimensions, which I hope has been clear from this presentation, that more than human approaches, again, include animals, but also other non-human entities such as chemicals and technologies. These are active agents in the making of health and illness and in constituting public matters of concern. We just want to bring that agency into view. By the social determinants of health, and again, just to perhaps be a bit cheeky to say it's the more than human determinants of health, I added that one in. I hope that's okay for those working on the social determinants of health, that what we're talking about here are things that don't necessarily lend themselves very well to genomic tracking and tracing. Education, healthcare, neighborhood and environmental issues, community, economic stability, access to technology and relations with animals, and we could add many other social determinants of health, or more than human determinants, if you will. And that these require attention as well, because these relations in their particular locales are in many ways integral to the ways in which we become healthy bodies. And that is not easily, readily, or perhaps even at all captured through genomic sequencing. And for this reason, we're concerned that genomic and the data sciences could obscure the social determinants of health if we're not complementing them with other ways of knowing. So our conclusions then are that genomic technologies, when integrated into existing narratives in biomedicine and public health, may reinforce the tendency to ignore the cultural, social, and economic influence on health and illness. That is the social determinants of health. We also know, and this is not just with COVID-19, but with other cases as well, that genomic data can already privilege certain types of expertise. In geography, for instance, a type of expertise such as efforts to monitor pathogens in people, which crosses over into surveillance. And again, this can obscure some of the critical capacities and knowledges in geography. So social scientists and critical social scientists in particular can play a role in calling attention to these social determinants of health by illuminating them. And what we call for is consideration of the diverse and locally specific ways in which humans and other critters, I use that term quite generally and somewhat tongue-in-cheek to refer to animals, viruses, chemicals, technologies, how it is that we live with viruses and infectious disease. But we also believe that creativity and persistence will be required to infuse both the insights, but also the ethos of more than human geographies, more than human public health, into existing COVID-19 science and public debates. So we will conclude then with a statement that genomic sciences are important. We are in no way denying the importance of the sophistication of our technologies, of our algorithms, of our statistical ways of knowing. Those are all crucial for making sense of this disease. But they are insufficient to make sense of the interconnected, meaning-laden, and context-dependent relations among humans and with other species that give rise not only to disease, but that also form the foundation of health. So thank you very much for listening to this presentation, and we will pass it over to you for a very mediated conversation. We here are also, interestingly, in a very trans moment where we are translated and mediated by technology in very interesting ways. But I wish to thank you for your attention so far, and we look forward to hearing your questions, comments, reflections, pushback, or whichever you like. From my understanding, we will be doing that through the comments section, the Q&A section, I believe. And Pablo, if you want to jump in, then we have no open questions yet, but we will be taking those as they come in. I don't believe you can participate orally.
Hi, Gwendolyn. Yes, if anybody has any questions, please type them up in the Q&A, and I will be able to see them and answer them as they come in.
So perhaps as we're waiting for some questions to come in, I've been doing the lion's share of talking, and I don't mean to put you on the spot, Melanie, but I'm wondering if there's anything that you wanted to highlight in terms of this complexity, this ways of working in transdisciplinary settings with issues that are inherently about, you know, these moments of translation, of boundary crossing, of disruption, at the same time that we know that state governments need to control and for better and worse some of these processes.
Well, one thing I could say is that through the process of working with you, Gwen, even though I had been following the news, somehow it didn't become immediately salient to me that what I think of as SARS from the early 2000s, which was integral to the creation, for example, of the Public Health Agency of Canada, that this was a close relative of COVID-19. The way of naming it in relation to, as you pointing out into relation with genomic sciences, for me already somehow obscured that shared heritage. So I guess that's an example of how when we name something, we make it clear, but we may also, for a broader audience, and I'm certainly part of that broader audience, not an expert in any way on the specifics of COVID-19 or viruses at all, but I would consider myself reasonably informed, and it means that some of the scholarship around SARS-1, if you will, or SARS 2002, is very relevant to us today, but we're not necessarily drawing on that for lessons for reflection.
And how some of those histories, I think, we have so much in our lives that require attention, but having opportunities to bring those histories to bear on our ways of thinking is very relevant. And again, in streams of more than human geography, there is quite a bit of research that has looked at these histories, and I'm thinking here particularly of the work of Bruce Braun, who has used the first SARS pandemic as a way of thinking through urban issues, and really something that I think those of us in geography might take as common sense now, but to think that you know, an urban place is never just a human place. It's always a more than human place. And so so that we start to see a way of thinking of a disease that can be very relevant for making sure that our social science concepts are reflecting the very you know, the very things that we're trying to get a hold of. And so he also called attention to the then emergent kinds of fields around what he called molecular biopolitics. And so his work has informed our commentary very centrally, that these kinds of molecular sciences are giving rise to new ways of seeing, new ways of representing, new ways of intervening, that are difficult for those of us who aren't trained in them. and even, you know, and one wonders what level of literacy is required, right? It can be very difficult to be asking these questions, and I myself find it extremely daunting, and takes a lot of technological capacity to even be able to look at these levels of translation. So, for instance, when I showed that image of the genome sequence, I was quite impressed that we had sequenced the coronavirus so fast, but it took me a while to figure out why it was, and I still don't know if I understand the full reason why we don't represent and publish the RNA genome sequence, why that is translated into DNA. And if anyone has any comments on that, I would really love to follow up. I mean, I've one thing that I've heard is that DNA becomes kind of a standard language, and so it also can facilitate the development of vaccines. And so one thing that we didn't talk about, another aspect of the trans dimensions, is the creation of, of using those DNA sequences then to create DNA segments for the use of vaccine development. And so we get a de novo kind of creation of new, I wouldn't call them life entities. I think maybe we need to rethink the notion of life as well, right? Like a virus isn't living until it, until it reproduces in another species. So it looks as though we have a question from Ryan.
Yeah, Ryan Burns.
Yes, Ryan Burns. I'll just read out the question. I wonder if socio-political institutions could be considered within your analytic framework. To my mind, the cultivation and propagation of COVID-19 has strong linkages to industrial capitalist farming and agriculture, the wet market linkage, the intense industrial context in which these animals are raised for human consumption. And this context is often lost when treating the virus as a purely biological, non-human phenomenon. Or is this analytic approach outside of the scope of your thinking here? Melanie, do you want to take that one?
And then I'd love
great
to.
question.
Thank you. So similarly, once I came to understand or appreciate that COVID-19 had this linkage that I hadn't really been able to understand previously with SARS from the early 2000s, then it also brought to mind the work of Eric Michalewski and Lorna Weir at York University, in which they looked at how Toronto as a city had been impacted in SARS circa 2002. And in particular, how the World Health Organization took on a certain kind of sovereignty in terms of an advisor to state governments. And we've certainly seen that in COVID-19. So to the point, yes, I feel as though fundamentally for us, trans-biopolitics is not only or mostly about the science, it's also about how these networks with global reach are transforming our everyday life as well as policy decision making.
And I would add to that the attention to socio-political institutions is absolutely fundamental. One of the challenges of advancing a concept in a short presentation, or even in a peer-reviewed, a journal article, is that there's so many dimensions to be addressed. And I know my thinking from 2011, when we did this analysis in relation to BSE until now, has changed in terms of thinking about those socio-political questions. And I I echo everything that you say, and I think that there's some thinking there that we can do to bring that in a little bit sharper, but also to think about what the science and technology scholar Sheila Jasnoff has called civic epistemologies. And so these ways of knowing that also infuse those socio-political institutions, I think, are very much part and parcel of this. And so it's again a way of bringing these ways that knowledge is tethered to the nation state, but the ways in which science is also pushing to universalize that, I think, is something that we see within the genome. So a paradoxical kind of reductionism at this, and a push for universalism that is also existing alongside this recognition of complexity.
And then we see from Michelle Anholt, thanks Michelle for your comment, that science has long interpreted complex systems through reductionism. So right on point. Thank you.
and genomics is further along the line of this reductionist approach to science, but we need to remember to back up and look at larger determinants. Yes, absolutely, and that is what we are saying.
Mm-hmm.
I think the challenge that we have is how do we do this, and how do we do this without falling into that first problem that we started the presentation out with, without being viewed by genomic scientists as antagonistic, as threats, right? Because I think that it's hard to have a dialogue, I think, in which we are not trying to denounce genomic science, but we do want to be critical of the ways in which it's being used, and how to find, I guess, friendly allies in the genomic scientists, because again, we need that. We need to have those linkages to be able to make sense of what's going on. And so, you know, it is a bit of a crash course, but recognizing that we're not either of us trained in the genomic sciences. Even my history, you know, training in microbiology, I started out in the lab working with bacteriophage, and that feels so dated. It almost feels like ancient history now. That you know, the types of microbiology I learned are completely different now. So I guess it's a call out and a seeking of similarly minded genomic scientists, or genomic scientists who are perhaps willing to engage in this complexity and to help think through these issues.
And then Ariel DC has asked, is your analytic also a critique of the social determinants of health at the same time as it calls attention to how social determinants of health are often hidden or disguised? To which I would say an emphatic yes. So as an anthropologist and as a social worker working within public health, then there are times when it has felt as though there has been what we might think of as a reification of the social as determinants of health. And for example, often there will be references to social and physical environments as though those are discrete. Now, in actual fact, people working in that area, and I do work in that area to some extent, will clarify that they are mixed together. But there are different questions and different methodologies that go with social environments and physical environments. And it does worry me at times that we are drawing on social science that is quite outdated in public health, and only from certain social sciences also more than others. And so anthropology and geography and sociology, for that matter, I would suggest have had less influence overall than economics and psychology.
Apologies for that. So we have a question from Tom Stelfox. How do you propose that institutions bring biomedical and social scientists most effectively together to tackle these complex challenges? We promote interdisciplinarity and interprofessional work, yet your talk highlights how much better we can do. That's an excellent question, and I think cuts to the core of the question that we are raising and struggle with. I think that it's an institutional problem, coming back to perhaps Ryan Byrne's comment about the need to take socio-political institutions into account. I think in some ways, one way that I would suggest is even recognizing that problems exist, and to understand that we have assumptions about what other people in other disciplines do. I will say that one of the, I guess, driving forces of this particular commentary has been from myself being invited to sit in on these transdisciplinary calls where, you know, the moderator would ask, well, what do the virologists think? Well, what do the epidemiologists think? What do the bioinformaticians think? And not once asking, what would the critical social sciences? Which would there'd be a lot of diversity there. But what I did find was that a lot of scientists spoke about what the social sciences could contribute. Right? So, well, the social sciences would be great here, but there was never a moment to ask. Now, to be fair, I could have said something, but I found in those situations that even when I do say something, I'm met with silence. perhaps because we speak with different terminology, we have different lenses. That kind of comprehension is difficult. It takes a lot of time in relationship building. So perhaps recognizing that there's power dynamics in our institutions and that the critical social sciences are diverse, we're different than the behavioral social sciences, and perhaps making space for these kinds of discussions. And so I'm very thankful to the O'Brien Institute for giving us an opportunity to show some different insights, but also to express some concerns. Melanie, I'm going to pass this over to you because I'm curious what you would say in response to Tom's.
Oh, I actually would echo that. So again, I think we do need these types of fora, and grateful for the staff with the O'Brien Institute who've made this presentation possible today, for all of you for chiming in, because even though in the commentary that was directed in the first instance towards critical social scientists and geographers more specifically, to highlight how the importance of engagement, the efforts that it's taken to get to today in the midst of a pandemic also highlight that these conversations are not easy to have, and we do need a network of common concern to insert ourselves into conversations, not only because we have something to say, but we also have a lot to learn.
Yes, and I'm glad that you mentioned the learning, that these really are collective learning. And in preparing for this presentation, I was talking to a friend, and I was a bit concerned that, you know, someone might challenge me on my understanding of genomics, and fair enough. But I'm wondering if another deeper concern is a silence. That it's okay if we're challenged, and again, it's okay to have these tensions and to have discussions and debates and to point out areas where we need more collective learning. I'm wondering if the silence and the ignoring of these issues is a bigger problem. And again, we are all faced under so much pressure with so much in our lives that taking time for those kinds of conversations are really difficult. So thank you for these great questions.
I would like to highlight again that both Gwen and I would be very receptive to email feedback. We've put up Twitter handles simply as anchor points for other types of conversations. The entire issue of dialogues in human geography, the special issue on COVID-19, is very instructive. Ryan Burns, who's on the call today, also has an important commentary published there. And I do feel in the coming months, where there's a number of special issues coming forward from social science journals and collections and individual papers that many of us are reviewing, that it will be a challenge, but also important for us to be drawing on this material in our teaching.
So yes, again, a call out to look at that special issue in Dialogues in Human Geography, but for amidst all the other reading that you have, I want to say a thank you to everyone again for taking time to listen to us, to dialogue in the small ways that we can in these mediated instances. And I wish you all a wonderful weekend, and hope everyone is safe and well. So I guess since we have no more questions on our plate, we will end it here.
Yeah. Thanks again, everyone.
Thanks.